Did you know that more than 50% of patients feel nervous about talking to their doctors? And but what would make it easier if they had just a few key English phrases? That would make such a big difference. Because when you feel sick or hurt, it's natural to worry about explaining your symptoms clearly. So today we're going to discuss mastering doctor visits with confident English phrases. Welcome to Mastering English Communications. Now, just having a little bit of confidence and knowing how to express yourself can help you get the correct diagnosis and understand your treatment options, as well as reduce stress. So just imagine yourself now walking into your doctor's office and confidently explaining your concerns. You can ask the right questions, make sure you understand the answers, and make informed decisions about your health. And that's what we're going to do today. I'm going to share 10 essential phrases that can make your medical appointments more successful and less intimidating. And just so you know, I've had to explain health issues in another language, so I understand how it can feel. Now, grab your pen, your paper. Let's get started. First phrase, I need help with. So this phrase can be used in many different situations. For example, you might say, I need help with understanding my medication schedule. This is quite normal if you're taking multiple medications or you have to take one or two medications, but on sort of varying schedules. Or I need help with managing my pain. Right? Using this phrase shows you're proactive and willing to ask for support when you need it. So the doctor is naturally going to be a little bit more interactive with you because you're asking questions, you're looking for information. It opens the door for clear communication, allowing your doctor to give you the guidance that you need. But if you're feeling overwhelmed or uncertain about something, you can also try saying, I need help with understanding my test results, as an example. Or I need help with figuring out what's causing my symptoms. Right? So this is an easy way for you to figure out by using the phrase and combining it with your situation at the time, how to put the question together. But the key is being honest and direct. You give yourself power and you let your doctor know that you're ready to learn more. Next, can you explain that to me? So now this is a useful phrase as well. Can you explain that to me? This is all about asking for clarity. This is not an insult or a challenge to the doctor and a culture like the one we have in the United States. You're asking for explanations that will help you understand your diagnosis and what the treatment plan is or should be. It actually will show respect that you're listening, you're paying attention, and you want to understand. You acknowledge the doctor's expertise, while at the same time, you're letting the doctor know that you want to be a partner in your health, right? You want to take charge of your health. It also encourages dialogue. So it opens the conversation between you and the provider that you have or the medical professional. Next, I've been experiencing. So when describing symptoms or changes in your body, this phrase is incredibly useful. You might say, I have been experiencing chronic lower back pain. And as someone who has hurt their back through in sports in the past, this one reminds me of my own situation. Or you can ask, I have been experiencing dizziness and lightheadedness lately. Being specific helps your doctor pinpoint possible causes and design an effective treatment plan, especially if you're doing telemedicine, where someone is speaking to you. They might not even have a video of you. They're just speaking to you on the phone, asking you about the symptoms. I've done that as well. So try to avoid broad statements like, I just haven't been feeling well. Instead, use precise descriptions such as, I have been experiencing numbness in my fingers, or I've been experiencing sharp abdominal pain. Specific details makes it easier for your doctor to understand your condition and recommend the best course of action. Next, we have, what are my options? So this phrase empowers you to explore different treatments or next steps. For example, you could ask, what are my options for managing my condition? Or what are my options for easing my symptoms? By using this question, you show that you're actively participating in your healthcare decisions. When you discuss treatment possibilities, remember to ask about the benefits and the risks of each option. Learning about potential side effects and outcomes will help you choose the treatment that's best for your unique situation. Now, if you're finding this information useful so far, please give us a like and leave a comment. Thank you. So next we have, are there any side effects? It's important to know the risks of your medication or treatment. You might ask, are there any side effects I should be aware of? Or, are there any potential risks with this procedure? This shows that you care about your safety and want to make an informed decision. Try to ask detailed questions rather than only saying, are there side effects? Instead, say something like, what are the most common side effects of this medication? Or how serious can these side effects be? Specific questions demonstrate genuine interest. Remember, once again, it is not an insult in an English-speaking culture like the United States to ask these questions. It's considered respectful. You're seen to be engaged in your health and the outcome. I would like a second opinion. Okay, so requesting a second opinion can feel a bit scary, but it's perfectly normal part of healthcare. And once again, I will emphasize the United States. You might say, I would like a second opinion on my diagnosis. Not an insult. Or I would like a second opinion on my treatment plan. Once again, not an insult. This is quite normal in the environment of the United States. And I'm emphasizing the United States because that's my culture. That's where I'm from. And so things might be slightly different somewhere else, but I have not encountered that in other English-speaking environments where I've had to use or speak to medical person. Asking for another viewpoint actually can also boost your confidence, especially if you're not sure about a diagnosis or a proposed treatment. So by seeking a second opinion, you're taking charge of your healthcare and showing that you're willing to be involved and to advocate for yourself. Next, what should I do next? So always make sure you understand your next steps before leaving the doctor's office. For instance, you might say, what should I do next to manage my pain levels? Or what should I do next to follow up on my test results? This question signals your commitment to your health and ensures that you leave your appointment with a clear plan. And as always, try to be specific when asking about follow-up actions. Focus on the exact steps, such as scheduling another appointment or starting a new medication. You want to have a clear understanding. Next, could you clarify that for me? This is a great phrase for when you need more detail, pure and simple. Once again, not considered rude or an insult. For example, you might ask, could you clarify what this test measures? It simply means that I didn't really understand, or I want to make sure I understand. So you simply say, could you clarify what this test measures? Or could you clarify the difference between these two treatments? By asking for clarification, you're showing that you want to fully understand the situation, and you're giving your doctor an opportunity to give you more information that may be very valuable to your situation and answer your question, which may add more to your situation in a positive way. I would like to discuss my concerns about, okay, we're human beings. Something is not right with our health, or we're sick, and we're worried. Of course, that's why we're going to the doctor. Right? We want to stop worrying and get well. So sometimes you may have worries that aren't directly related to a specific symptom, but are still important to your overall health. You can use this phrase to open the conversation about emotional or financial or personal concerns that affect your care. For instance, you could say, I would like to discuss my concerns about the cost of medication. And sometimes, and once again, I'm using the United States as an example, the doctor may recommend something that's just as effective, but more budget friendly. Right? Now, this type of approach will help your doctor understand your bigger picture and tailor your treatment to your life situation. And then, lastly, what should I do if my symptoms get worse? Even with a solid treatment plan, it's important to know when and how to ask for additional help if your condition changes and not for the better. By asking, what should I do if my symptoms get worse? You ensure that you have a clear plan for handling unexpected problems, or if you're not healing as expected. And your doctor might tell you when you call the office when to go to urgent care or clinic and how to adjust your medication. Right? See, all of these things are very important. That's why these questions, though basic, are extremely important to you as someone that English is their second language or more, that they're able to communicate as well as possible when it comes to their health and they're in a situation where they need to speak to a medical professional. So now, mastering these 10 essential phrases will help you communicate more effectively with your doctor and take an active role in your healthcare journey. Now, by using phrases like I need help with, can you explain that to me? And what are my options? You can feel much more empowered and confident. With that being said, thank you for watching. I hope this was informative. Please like, share, subscribe, and as always, leave a comment. It helps us help you. Take care, everyone, and see you next time as we continue our linguistic adventure together.